So I think the first thing to explain is that when we look at veterinary behavioural medicine, what it is the part of medicine looking at the triad of health. How many of you are familiar with a health triad concept? It's very commonly talked about in human medicine, only recently talking about it in veterinary medicine. But basically, as animals, of which we are animals too, we have three components to our health. So we have emotional, cognitive and physical. And obviously as veterinary students, we're very much taught about physical health. It's all about physical health really, although recently hopefully a bit more creeping in about emotional health as well. But looking at that triad and looking at the balance of it is really what behavioural medicine is about. So it's recognising that those three parts of your health are equally important. That makes sense? So you can't look at one without the other. They integrate with one another. And therefore, it's a day one skill just like any other piece of medicine, and it's something you're going to be dealing with on a daily basis. Although we're going to look at these two scenarios of the biting dog and the howling dog, we're also going to, first of all, look at how it actually relates to every single case you see, and therefore you'll be using the same approach as you look at those specific presentations. So starting off by assessing emotional health. So basically what I mean by that is identifying, first of all, what is the emotional motivation for either the behavioural response, the two things we're talking about today, but also the physical responses that you see. Also will have some emotional component to them. You can't divorce emotional, cognitive and physical health. It's all part of the same triad and they influence one another. So understanding emotions helps us not only in these specific cases, but also just in being a vet. And then once you know which emotions are likely to be involved, you've then got to think about, well, what's affecting them? How is emotional health affected? You're very familiar with how physical health is affected. So you're very familiar with concepts of metabolic disease, concepts of infectious disease. You're used to thinking in that way. But now what we're going to be trying to do is get you thinking with a presentation of a behavioural case in exactly the same way. Then thinking about what are the factors that influence that, we need to think about the fact that emotional capability goes right back to your genetics and your early history. So we'll look at, when we're looking at assessing emotional health, how does that influence where the animal came from, what its genetics are, what its early history are, how does that affect what's happening now with this animal as maybe an adult in your surgery? Its history, so in terms of its experiences and the environments that it's lived in, is also going to be important. So when you're faced with a patient, we do need to know a little bit about its background if we're going to understand its emotional component of its health. Same in physical health, isn't it? If you live in areas where you have a lot of imported rescue dogs, then maybe you think about a different disease profile than you do if that animal's never left the UK. Okay? So you're used to, again, the concept, but not thought perhaps about putting it into an emotional context. Then where is it now? Where does this animal live now in terms of its physical environment and also its social environment? So who is it living with, both human and non-human, and what is the environment that it's living in? And then its physical health, because they interplay with one another. So when you're presented with that howling dog or that biting dog, its physical health history is going to be relevant. Is it a diabetic dog and it has elimination accidents when it's left on its own? It's actually nothing to do with its emotional health, it's just because it has a physical disease. Or if it's an animal that's bitten someone, does it have chronic pain? So having an understanding of that basic physical history is going to be important as well. The next thing, as well as the motivation, is the level of emotional arousal. Is that a subject that or concept that you're familiar with? Arousal, not just motivation. Yeah? No, some people not, some people. So we're going to go through that, look at the difference between what is a motivation and what is an arousal. And sometimes it's the arousal that's the biggest issue, particularly in the sorts of cases that we're talking about today, those two particular presentations. Arousal is incredibly important when we're thinking about how we might help an owner to manage those sorts of problems. And then the level of emotional resilience, again, another emotional concept that we're going to talk about today. So not just which motivation, but also arousal and also resilience.